Well, we are seeing a slight uptick in COVID cases here in Ohio, but is this the calm before the storm? Is the new variant going to cause havoc?
Yeah, so let's really put this into perspective for you. Who else to do that than our senior health correspondent, Monica Robbins? So we know we were just talking that the cases are up a bit, but you'll put this into perspective for what it really means.
Yeah, I think perspective is a very key word here. So most cases went up from 7,800 to 8,600 this week. Hospitalizations dipped slightly to 163 in the entire state, although ICU admissions jumped 50% to 12 cases, and there were 13 deaths, which was slightly lower than last week. We would have given anything to see numbers like this during a surge, so there is no reason to panic. But remember, these are only reported cases. There are likely far more people out there with COVID, but they're not sick enough to require medical care. Now, currently, there are 14 variants of concern circulating in Ohio as of August 12th. Arcturus, or XBB 1.16, makes up 16% of cases. That's the most that we're dealing with right now.
Okay, so a lot of people are talking about vaccines again. It's been coming up a lot. When will we see these new COVID boosters?
Very, very soon.
Okay.
So NBC is reporting that the FDA should sign off on them as early as tomorrow. The CDC is set to talk about them next week. They'll probably follow, and both will indicate who should be vaccinated and when. And as we've been saying, they should be shipping out by mid-September. And remember, they're designed to target Omicron XBB 1.5, the one named Kraken that made up about 12% of cases in Ohio as of now. That's the last time, August 12th, was when variants were listed by the Ohio Department of Health. So experts add the vaccine should still provide protection against current subvariants circulating, including Arcturus or XBB 1.16, which is still prevalent. And that's what everyone needs to remember. There are so many different variants out there, but they're all related. So the vaccine should prevent anybody not from getting sick, from getting severely ill and dying. The vaccines were never meant to prevent you from getting the virus, which I think a lot of people forget.
Yeah, that's a really important reminder. And kind of on that note, too, of the variants, I mean, last week we reported in Ohio that there was that third case of Pirola. It was over in Lorain. So kind of what does this mean? Do we need to keep an eye on this one?
Yeah, that was the one that everybody was really worried about. BA 2.86. That one has about 30 mutations, which is what sparked worry, because that's how different the first wave of Omicron was compared to its predecessors. But in the last few days, several lab studies are showing that it's doubtful this one is going to lead to a major surge. The current variants circulating like they've been heading into cold and flu season, when you compound all of the viruses, influenza, RSV, COVID, yeah, it's going to be miserable for some. That's why you need to talk to your healthcare provider about what vaccines you need and when, and it all depends on your age, health status, and exposure risk. We have been through this before. Use common sense. If things get crazy, take the precautions you've already learned about, but remember, these COVID vaccines and flu vaccines and RSV vaccines were meant to prevent you from getting severely ill or dying, not to prevent you from getting the virus. I can't say that enough because I think there's so much confusion out there about what they're supposed to do.
Absolutely. Monica, we so appreciate you putting this all into context for us so that we understand and don't panic.
Use common sense, please. Wash your hands, wash your hands, wash your hands.
Wash your hands.
Can't say it enough.
Thanks,
Yeah.
Mon.
Sure.
Reminders.